Welcome to Rural Health Today. I'm JJ Hodshire, President and Chief Executive Officer of Hillsdale Hospital, and this is a podcast where we connect you, the listener, to what really matters the most in rural health. And I am thrilled to be in the studio today with a very special guest, a guy that I can call friend, someone who is a visionary. It is Scott Becker, founder and publisher of Becker's Healthcare. And Scott, if you recall his name, he has been on our podcast before, Rural Health Rising, and now it's great to have him on our new podcast, Rural Health Today, which is an expansion of Rural Health Rising, really focusing on rural health throughout the country. We have an amazing listenership. And Scott Becker is a guy who knows all about communication. He knows all about information because as the founder and publisher of Becker's Healthcare, he's the guy that convenes all of the leaders from throughout the United States together several times a year, and it's coming up soon, several times a year to have conversations about best practices in healthcare, about some of the challenges that we're facing around our respective communities and how other communities are dealing with problems. And it's a wonderful opportunity to share with colleagues, but also to hear some of the leading experts in healthcare. And there is nothing more that joys my heart than to introduce my friend and an industry expert, Scott Becker, to our podcast, Rural Health Today. It's great to have you with us, Scott.
Well, no, JJ, thank you so much for having me. We're excited to get to visit with you. We always enjoy it and can't wait to have a discussion. So thank you so much for having us.
It's going to be great, Scott. And so let's first start. Many of our listeners know you. I often hear it's one of our widely recognized podcasts when we have Scott Becker, and I often get dozens, true story, of text and phone calls and emails afterwards saying, "You really know Scott Becker? Can you introduce me at the next conference?" Because you are quite the visionary, and it's great to see you up on the stage when you are, because what's really important is you're having very tough discussions with some of our leaders, political leaders, healthcare leaders, and we're tackling some very big issues. But for those who may not know you, Scott, could you take us through a little bit about your background, how you ended up working where you work? I know your background. I love it, but I want our listeners to know it.
Sure. No, I appreciate that very much. So I'm the founder and publisher of a company called Becker's Healthcare. And just to go way back, I started it 30 plus years ago, and I was a kid then. I'm a lot older now, but we started it really not intending to grow a media company. We were trying to be a thought leader. And back in the day when I did this, people didn't even use the term thought leader. That's sort of a newer term. But trying to be a thought leader in sort of healthcare, more the business of healthcare than the clinical nature of healthcare, and trying to be what we thought of as the Wall Street Journal of healthcare, to give people a sense of here's what's going on in the business of healthcare. And over the years, from going back 30 years ago, that grew into something much different than I thought it would be. It's still very, very focused on the biggest areas, hospitals and health systems, then health IT. Then we've got other areas around orthopedics, now around payers and some other areas. But the largest focus is what's going on with hospitals and health systems in the country. And as JJ said, we have conferences, websites, electric newsletters, and so forth. And we try and give people a sense of what's going on. I used to write back in the day, deep research papers on healthcare, and people wouldn't read those. And what we metamorphosized to over the years is much more what you think of as short form journalism. Somebody could read us in the morning, get a sense, oh, here's what's going on. Labor and delivery struggling in rural areas. We're having this kind of challenge, that kind of challenge. Am I alone, or is it the same problem that everybody else is facing? And that's the gist of what we try and get for people. Then we try and convene people where they can talk about these issues. And a lot of the education really comes from peer-to-peer networking and talking versus lectures. And that's really the model that we work with, and try and stay in front of people and try and make sure we're fluent in what's going on. And it's been a great pleasure.
And you do such a great job. In fact, we have a conference coming up in Chicago here very soon. I'm actually a panel speaker for a couple of the sessions. Always love it. Always love hearing from our colleagues and then seeing some of the world leaders up on the stage. And before we get into, the meat and potatoes of our discussion today about healthcare in general and some of the challenges, I want our listeners to have maybe a fun fact about you. Now, I know a fun fact, and if you don't say it, I'm gonna, but you may say it. But you want to share a fun fact with our listeners that might connect you to them a little bit about who you are as a person?
Sure. Well, there's so many. I'm an awful golfer and so forth, but that's not really a fun fact. We try and improve, and I've gone from terribly awful to awful. But no, we've had a chance to interview President Clinton, President Bush. We had a chance to work with when I was in law school, President Obama, who was a student in a class that I was a teacher for. And so we've had a chance to meet a lot of these different people, and Hillary Clinton, for example. So I would, you know, I don't know where I'd put myself on the political spectrum, but somewhere as a centrist. And so many of these people, when you see them on TV, when you hear how they're portrayed by one side or the other, you find when you really spend time with them, they're quite different. So George Bush is really about as wonderful a person as you'll ever meet. He's a very centered person. Hillary Clinton, where some of the TV I watch portrays her negatively, when I've gotten to know her over time, just a wonderful person. Like if I had to have dinner with Hillary and my family, we would love to do that. But so one of the things I find fascinating is the difference between public perception and how people actually act and what they do. And it's not the be all and end all, but we find most of them quite interesting. Particularly when they're willing to talk as people versus being on message all the time. But we find we try and be very balanced politically from the right to left. I just had a chance recently to have on the podcast Marty McCary, who's the FDA commissioner right now, and he gets a lot of flack from a lot of different sides, but he's a crazily intelligent person, and he's a very thoughtful person. He's not just off the whim on stuff. He's a very thoughtful person, and so it's interesting to hear the different perspectives when you see the news say, this person's this, person's that, and then you meet him, and he's like, and I've met him a few times. Just a very, very bright person who's trying very hard to do the right thing.
Yeah, one of the, I'm glad you told the interesting story of, President Obama, because that was one of my favorite stories with you, is hearing that story, how you taught him in the classroom. That was pretty awesome.
Yes, and we can go into more depth on that. I mean, when I taught President Obama, him and another student were two of 12 students in my class, and the two of them were, whether you like President Obama's politics or not, he's a very bright person. And so was this other person in the class, a famous judge's son, Richard Posner's son, who's a famous judge. The two of them were in the class, and both of them were truly, and this is not false humility, much smarter than me. And so they would explain to the class, I think this is what Scott is trying to say. And I would literally
That's my favorite story.
Yeah, no, and I would feel like I was in a Saturday Night Live skit, like I was Chris Farley. They're like, yes, exactly. That's exactly what I meant. But they were very bright. And
so here, Professor Becker gets up to speak, gives a lecture, and then, President Obama says, well, let me tell you really what he meant. I love it. It's great.
Well, it's right on.
It's pretty awesome. But, one of the things that was eye-opening to me is many years ago, I was at Becker's conference, and you had President Bush, GW, on, and you had him on the stage, and afterwards we had a chance to visit, and one of the things that you asked him was about he had taken a beating back then for the war and some other things, and I remember very distinctly he said, Scott, he says, history's going to judge me, you aren't. And I think what was really important about that lesson is in all politics, everybody's got an opinion about all these political leaders and all of these healthcare leaders with big names. But at the end of the day, history is going to judge us all. And I think a guy like Scott Becker is on the right side of history. What you're doing is you're bringing and convening leaders from throughout this country and at times the world together on the stage to have meaningful conversations. So I want to thank you for the work that you've done. You have some amazing stories. I'd love to share a lot of those, but for the sake of our time today, we can't get into all those. But I would encourage our listeners today, that if you have a chance to ever register for one of the best conferences in healthcare, I'll tell you it's Becker's. The breakout sessions are incredible. And then what you get from Becker's is you get a resource of information almost daily. There's not a day that goes by, Scott, that I'm not getting a CFO update, a CEO update, an IT update from Becker's. And this is where many of the times I will quote many of my sources and stories for a lot of our podcast, as well as my reports to my board. And as I speak throughout the country, I'm talking about the work that Becker does to get information in front of us. So I want to thank you for that, Scott, and for the work that you and your team do. And today we're talking about how to navigate the current state of healthcare news and insight and understanding. Healthcare has been a top contender for breaking news headlines all year. Many conversations that once belonged exclusively in health and science are now common political debates. Right now, they're happening across the country, and they have been really for the last several years, but in the last year, it's been intensified. And Scott, I'm excited that you're here to share your perspective and insight on one of the most trusted news sources that you provide through Becker's Healthcare. And so we'll talk about understanding data, asking the right questions, and of course, what does all of this have to do with rural health? So Scott, you've been in the healthcare news industry for a very long time, decades, in fact. From your perspective, what does over-politicization of health issues such as nutrition, pharmaceutical, vaccinations, all of those things say about the future of healthcare? I mean, there's a lot out there right now. It's all politicized, and it seems to be you're either left or you're right. And it's I can just go right down the road here to my alma mater, Hillsdale College, and there I can hear speakers talk about things that are on the far right, and then I can turn on the news and hear things on the far left, and you have a lot of folks in the middle going, what is going on?
Sure. No, it's a great question. It's a challenging question. What I try and always come back to, and it's been a lifelong belief, that almost always the truth on most issues is somewhere in between. And where we get into so much trouble is when people get positional on one side or the other and aren't willing to understand what somebody else is saying. And there are so many examples of this. I mean, obviously, the vaccine situation is an incredible example of this. It's most everybody, including Marty McCary, who's in charge of the FDA, is very pro what he would consider the essential vaccines, all the vaccines that were given to us our whole lives, the MMRs, the polio, and so forth. And he's not anti-vaccine. You can hear RFK talk sometimes and think that he's overwhelmingly anti-vaccine, and sometimes he sounds like that and feels like that. The reality is we've got this, the reality and all the stuff is somewhere in between. We've moved from a small number of vaccines to a huge number of vaccines, not necessarily right or wrong, but we are entitled and it's okay to have a discussion on them. When we don't have a discussion on it, we end up with people getting into camps that are anti-vax camps, pro-vax camps, and when you don't have this discussion, it gives the people that are on one side of the issue or the other, if you're not willing to have the discussion, they get more and more agitated. And this leads to bad outcomes. So, for example, we're in some states with the lowest level of vaccination on certain vaccines, and I think are very necessary vaccines that we've been in a long time, like some of the measles, MMR, rubella, polio vaccines are going down in certain states, and that's a bad outcome. But there's a reason it happens. When you totally try and shut up one side of the argument versus the other, that side of the argument gets angrier and angrier and then becomes more prone to making vaccines less mandatory. And the reality is, across the spectrum, right and left, you need to be willing to engage in real discussions of these issues, because pushing them down and just pushing your position over somebody else, it doesn't mean they're going away. They're not going to agree with you. It means that they're going to have more belief that their position is right because they don't feel heard. And so, I mean, the reality, I think it's one of the big problems of our political system. Currently, one of the big problems of our political debate is when one side says something, the other side doesn't say, let's try and understand it. Let's try and focus on it. They try and say, you're wrong, shut up, we're done. And that leads to an incredible amount of agitation in public forums. And then it happens in a lot of states because people that are very, very bright people become very anti-vax just because they're so irritated with being shoved down with them one position or another. And the reality is the vaccines are very, very important. Some of them we went from a spot, and some of this is dosages versus number of vaccines, but we went from a spot when you and I were growing up, 10 vaccines or so, to now 70 different doses over the course of 5 or 6 years. And there are a lot of people that believe that those vaccines have caused some challenges. And I don't know the answer on that. I don't know. I believe vaccines are largely safe, but you can't convince somebody who's got a kid who's got autism that saw that evolve after the vaccine that they're right or wrong. I mean, they might be wrong, but it's very hard to convince them. And if you're not willing to at least listen to them and trying to have the discussion, then you're certainly not going to convince them. And so we talk to very, very bright people on both sides of the issue. And I think that the challenge, I come back to this on almost everything. The truth on almost everything is somewhere in between. It's not, yeah. And if you're not willing to hear both sides, it doesn't lead to a good outcome. It leads to positioning, and then people strengthen their positioning. And like, for example, this concept to me, less vaccination of what were traditionally the essential vaccines in certain states is a bad outcome. But that gets pushed because the people that are pro-vaccine aren't willing to even have a discussion with people that are anti-vaccine and try and say, like, of course we need the essential vaccines. And that's what Marty McCary says at the FTC. Yes, of course we need all the essential vaccines. And then there's this issue of what's essential versus what's not. But he's not anti-vax. He's at least willing to understand, do we go too far on it or not?
So Scott, I'm going to ask you a tough question. It's how do we bridge the gap in your mind? I think one of the ways that we're bridging it, that you're bridging it, is, and I have to say that when I first started attending Becker's 15 years ago, I did not know if Scott Becker was a Republican, Democrat, Independent, what you were. I honestly, and I still don't. But what I do know is that you take interest in all of the party spectrum, and that you have meaningful dialogue on stage, and you've asked some very tough questions when I've been there of Hillary Clinton. You've asked some very tough questions of George Bush. You've asked some very tough questions of political leaders. But to get to that equilibrium, to get to that middle ground, what do you think needs to happen right now in our communities?
I think, again, I truly believe that a huge percentage of our people are actually curious and more centrist than you would perceive. So, for example, I would say that I'm fiscally conservative, socially liberal, at least all within reason. And everybody's perspective on that is different as to what's socially liberal, what's fiscally conservative. But I've always viewed myself as really a centrist. And so there's things that, like, I dislike about this administration. There's things I love about this administration. I do think that politics in general, we have a less amount of actually problem solving versus politicizing. And that's on the right and the left. I feel like on the right doesn't really have great answers on healthcare. The left's answers on healthcare have been driven a lot by different industries, by other things. And they're again, on both sides, are laid out as absolutes without looking at what's the impact of this. And like, for example, when I hear people say we need coverage for all, I don't disagree with that. We'd like to have coverage for all. But adding in coverage for all without fixing our supply problems is like writing a check you can't cash. That just is, and it's just platituding. It's not really having a discussion about, okay, how do we solve the real problems, supply and demand throughout our country? And obviously the rural areas, some of the inner cities, particularly when you get out of the top 10, 20 metro areas, the healthcare shortages are very daunting. And we talk about that all the time. And technology, prevention, GLP-1s are all important, but we better have enough nurses and doctors as well. And we don't see a lot of work in DC to try and actually solve problems, neither the right or the left. And it's not, we're equal opportunity critical of both sides.
Well, if nominated, will you run?
Yeah. No, I think it's impossible to run today. It's just that you spend all your time. I'd love to,
Well,
but it's impossible.
I'm still going to be your campaign manager, all right?
Yeah, I would love it, but it's not in the cards,
See, I know it. So, Scott, I learned about, believe it or not, my first introduction to AI was at a Becker's conference. And I'm sitting in a room, listening to speakers going, what is this? Truly, true story.
Yes.
And I came back to my staff and I'm like, all right, we got to start looking at this stuff. And years later, of course, now it's here. And what in your mind, in perspective of all the research you've done and what you've watched, the utilization of AI in healthcare. There are a lot of people that are very skeptical of this. There's a lot that are embracing it. What where should we stand? Are there good
Yeah,
applications? Give me your
no,
thought.
I think what happens is it's much like the evolution of the internet, evolution of the iPhone. Obviously not to date ourselves, but we're old enough to remember when there wasn't an iPhone, and now 20 years later, it's omnipresent. The iPhone, it's involved in everything. I think it will be an evolution of where AI involves itself in healthcare, where it evolves, where we start to use it more and more. But I think it'll be a kind of thing where it happens in tiers, it happens in waves, where it becomes more and more part of the makeup of what we're doing. The electronic medical record is a similar story. If you went back 20 years ago, EMRs weren't really a thing, and now they're every place. And even though people criticize the EMRs and this or that, we couldn't live without them. I mean, as a patient, one of the beauties of healthcare is we're all patients, we're all consumers, so we see it. You couldn't live without the EMR, and it took a long time to get there. At some point, the AI and all the AI solutions will not be in pockets, but they'll be more pervasive across the system. And anybody and we're going to keep on watching over the next several years to see where it becomes deeper and deeper. It's become very deep in certain areas administratively already. It's become, for example, in revenue cycle, people are using it a lot, particularly almost out of necessity to fight with the payers that have so much power. You see it in scheduling, moving in that direction, but sort of with starts and stops. You see it on predictive analytics. You see it on a lot of different operating room scheduling, how that works. Companies that do those things, predictive analytics, sepsis, falls, et cetera. I mean, different areas where you'll see it evolve, and I think it'll be like the iPhone or EMRs. At some point, we'll be in a world where it's touching a lot of different pieces of it. And then the question is, we always talk about in healthcare, and this is a big issue for rural healthcare, are there 2x solutions that leverage our nurses and doctors, or there are 10x solutions that can replace them what our doctors do? And the 2x solution only goes so far because we're still very short human capital, doctors and nurses in our country, and that's getting a lot worse, and it's really tough in rural communities. I'm a believer that we want artificial intelligence, technology, GLP-1s, prevention, but we also need more doctors and nurses so that we have a combination of both. I don't believe that, like, when people say we don't need more residencies, we're not going to need doctors, I just think they're wrong. I think we're going to need both. It's sort of trust but verify. So we need lots of doctors, lots of nurses to go with the technology, to go with the AI and everything else.
I would agree. Scott, we had AHA President Rick Pollock on the podcast a few weeks ago. And, Rick, we dived into a lot of issues. Of course, there's a lot going on in Washington. And, one of the things that really struck me with my conversation was Rick's statement that in his, I think, 5 decades, maybe, I mean, he's been there a long time working in Washington. He's worked for a lot of congressional leaders and then Department of Defense, et cetera. But he said it's very transactional in DC right now, and it feels very transactional. And you've had 3-4 decades now of looking at the news cycle in Washington. What's your take today? I mean, just give us your perspective, because I think it's important to hear a different perspective.
No, it's a great question. And Rick Pollock's a really, really good leader. He's the CEO leader of the AHA, and he's literally about as good a person as they come, a truly incredibly good, balanced leader, just a really good person. What's the problem with Washington? We grew up in a period where the middle of the right, the middle of the left were much, much closer than they are today. Now, on each side of the table, you've got different things that have led to this. We've got an incredibly difficult primary system. Everything's been gerrymandered. So out of 435 districts, some crazy number of them are either absolutely right or absolutely left. They're not. So the primary decides who's going to win that election, and that's led to the primaries becoming more important. The primaries on the right pushing to the right, the primaries on the left pushing to the left, and then by the time you get to DC, the people that have things in common in the middle become a smaller and smaller group, because there's more and more people that are strong progressives on the left or very strong conservatives on the right, because they come from districts where that's sort of is eaten up and really wins and works. So you've got this very divided electorate, and until I sort of like and who gets elected in DC, and it makes it harder for people to work together. What I remember about visiting with Hillary over the years, visiting with President Bush over the years, is you could understand that they had a little bit of this problem of saying something to their base, but then going and doing deals, and they could sort of do both because the base wasn't so crazy that they weren't willing to listen to, like, oh yeah, but I still have to negotiate with those people. Now you've got a situation where with social media, with political fundraising, if somebody goes in and says, I want to deal with this person on the other side, they become sort of like, on the Republican side, they get called a rhino, a Republican in name only. On the Democrat side, I'm spaced on his name. The guy from West Virginia, I'm spaced on his name, Joe Manchin. But Joe Manchin, was willing to reach across the aisle a lot. He's in West Virginia. It's a pretty red state. He's a Democrat, but he's willing to do it. And he sort of gets ostracized by the Democratic Party. And similarly, Liz Cheney. Liz Cheney could like her, you could hate her. I know she's become like a what have you, an outcast in the Republican Party, but you used to be able to reach across sides and do deals and not get totally killed by your base. Now, if you're in the center in the Democratic Party, the people on the left want to kill you. You're almost as bad as a Republican. If you're a Republican and you're in the center, you're called a rhino, a Republican in name only. And the reality,
I've been called a rhino many times, Scott.
100%.
And I guess it is what it is because I wear it too proudly. But at the end of the day, I think we need a little more of those folks in the middle to see across the aisle, and they get lost in their own aisle. And I think, we start to see some of the challenges of Washington. It's that gridlock that occurs, and usually the gridlock is broken, but now it seems like Washington's broken, and we got, this right now standstill going on in Congress. You've got the federal shutdown. And I guess I want to ask another question relative to that. The young health professional of today is, as a young leader who's looking at, they just took over their CEO job of a community hospital, or they're leading a big organization, it doesn't matter. But there's so many challenges that are facing healthcare today. 340B cuts, big pharma. Then you've got the issue of what's happening with Medicaid cuts. In communities that have 80% Medicaid, we have 72% Medicaid, Medicare here. A cut to Medicaid means a cut to the hospital. It could go away. Then you factor into there nurse recruitment, non-existent. Physician recruitment. You talk about the talent pipeline that's disappearing for professionals. You talk about unionization. All of these issues, work-life balance that everybody wants, right? What advice would you give to a young professional or a healthcare professional? They don't even have to be young, to better understand what's going on in their industry. What do they need to do? How do they tackle all of these things? What is the right source of information? Where could they get it?
Yes, no, I think it's a really challenging situation, a really challenging world. And it comes back to a lot of things that have always been the truth, is that you can only set so many goals and initiatives at a time. So if you're like, I've seen small rural hospitals that are great places to be taken care of. And I've seen small rural hospitals that I remember being in a board meeting a long time ago in a very small rural hospital, and none of the board members would take their families to that hospital for care. And that's like, that means that hospital needs to align and get out of business, or not be out of business, but align with somebody who could manage that hospital how it needs to be. But what happens is you start with, we're in this information overloaded world. And so I look at sort of the oncologist job today. I use this as an example. Is an impossible job. They're overwhelmed with empathy for patients. They're overwhelmed with complication of cancer, and there's so many resources being thrown at them, and we don't have enough of them. It's just a brutal situation. So when you're in this situation as a hospital leader and you've got so many different challenges, there's only so many things you could do. So you got to focus on what are the three things that are my biggest priorities. It's the same thing that all of us have to do in our own lives, because the world's become so much more complicated. There's a great book in this concept, a different concept but similar, by Cal Newport, called Deep Work. And the concept being that with so many challenges and so many challenges for our attention, that there's a loss of the ability to think deeper, to really focus on a few priorities. And I look at that as such an important quality going forward for leaders. Like I had dinner with a math teacher the other day who teaches advanced calculus, and he's been teaching for a long time in the same material. And his concept was, I've got the most challenging group of students I've ever had, because the students are so used to having attention go in a million different directions versus being rigorous about what they're doing. And I think it's a really challenging, evolving situation. And I think for leaders to be constantly conscious of, what are my top 3 or 4 priorities? What are we trying to accomplish? Who are we trying to take care of? And I think the point is, like, when you speak about, you know, we're actually trying to take care of the people in our community and do it the best we can. And it almost gets back to this old adage of leadership. As a rural hospital, unless we're in a big enough rural area and we could hire enough nurses and enough staff, we can only do what we can do. So what we have to do is focus on, what do I actually have to do here so people could then get to a metro system if they have to. So, for example, I need to have stroke care because stroke care has been proven, if I don't get it done quickly, the person's result in brain damage gets really significant. So I need to have stroke care. I need to have a number of other things. It's the labor and delivery thing is a disaster. And it's going to get worse. And it's a problem because it's not so much the systems don't want to staff it. They can't staff it and make it work. And this becomes a very negative cycle for rural communities, because if you can't have families being born and raising kids in those areas, it ends up being a very, very challenging situation. So you end up having to have enough critical mass in areas that you can afford these things and provide these things so that you're able to take care of people. And people talk so much about technological improvements, doing things through telehealth and so forth, and that is all great. But we still need enough people, doctors and nurses, to take care of people and to make sure that we could deliver babies and grow a community.
Let's transition a little bit because I know that you have a very successful podcast about private equity and business and the marriage of the two. What motivated you to start this podcast? And I guess maybe you can reflect upon it. What has been standing out in your mind and your conversation with your guest about that?
Sure. So yeah, several years ago, I started a business and private equity podcast, and it goes back several years ago. And I call it an advanced hobby versus a business, what I do on the business side. But it was partly trying to broaden my own coverage, my own thinking around business, not just around healthcare. And I've been involved in really a couple serious businesses, served on some boards, and wanted to talk and grow my thought leadership and grow my thinking around business. That's what really motivated me. We mostly do short episodes there that keep me up to date, and hopefully our audience, on the takes of what's going on in business. A lot of just the basic stuff, but trying to keep it very simple, very short. And so I could stay abreast of it, and hopefully people could learn from it as well. And I enjoy it tremendously. It's one of the things I enjoy the most that I do. And so, what have I learned? Private equity comes in all shapes and sizes. So private equity is a very easy bogeyman for Washington, because who likes private equity? I think the fascinating thing about it is private equity, I think, employs like 6% of all physicians in the country, private equity and private equity related companies. 8% of physicians are employed by Optum United. So this is all of the private equity combined versus one company. Private equity, they're good and bad. Private equity, when they put a lot of debt on something in a low margin business, it's a disaster. So if you look in the hospital business, something like 8% of private equity of hospitals are owned by a private equity funded chain. A couple of those are quite good, like LifePoint and what was Ardent Health. A couple of those, like Steward Healthcare, ended up being a disaster because they over leveraged themselves and ended up in trouble. And then the Steward hospitals went broke. So private equity could be good or bad. It depends on the extent to which they use leverage and debt, the extent of margins. I think it's a fascinating discussion. It's not. It's sort of like it's like so many things in our good and bad. The truth somewhere in between. Some of them are good operators. Some are horrible operators. And that's true of the for-profits, true of the not-for-profits, true of everything else. And the thing that's forgotten is a lot of the private equity acquired hospitals are hospitals that were otherwise going bankrupt. So, you are not. Sometimes the private equity fund or sponsored company is buying a really successful set of operations. Often, a lot of these private equity driven deals were built around smaller health systems that were really struggling and then tried to make it work. And they've had no luck making it work either. And that's not necessarily in the private. That was a challenge to begin with.
Fascinating work that you're doing around that as well. Um, it's hard to believe time just escapes us. I could talk to you for hours, but it's coming to a close here, and I want to ask you a question that I posed to you last year at this time. Usually, I like to get in advance of the Becker's Healthcare Conference in the fall, and ask you this question. But earlier this year, I asked you about some of the biggest headlines in healthcare, and you answered, and most of those came true. And some of the things that you were asking us to watch out for, we did. And there were a lot of things that happened that didn't fit the predictive model that you and I would have had for this year. But as you near the end of 2025, I'll ask you the same question. What are some of the best or worst things that you've seen recently in national healthcare? I mean, you followed it
Yeah,
all.
I don't know if I'd say best and worst, but I do think we've got three or four things I talk about all the time. We've got what I think of as a math problem, a supply and demand problem. We just don't have enough doctors and nurses to take care of people in lots of different places. And this is a real challenge, and it's going to get worse. We've already got a two-tiered health system. It's quickly becoming a five or six-tiered health system, meaning two tiers between commercial versus people that were on Medicaid or people that are impoverished. We always had two tiers. We could say differently, but we've always had a couple tiers. But now that other tier is breaking into several different tiers, and healthcare is getting just very, very expensive. The average cost now is 25, 30,000 for a family. Most families don't make 100,000 a year. The vast majority don't. That's a crazy expense given the income that people make in our country. So supply and demand is a fundamental problem. We have a fundamental power problem. The 3 to 5 biggest insurance companies are just so large. Two of them are two of the largest companies in America out of the top 5, two more in the top 20 countries in America. Power imbalance between the insurance companies and the providers, the systems, is just it's off the charts. Just a brutal power imbalance. So we've got a supply demand problem. We've got a power problem. Um, the insurance industry right now, we're at a spot where I don't have the exact numbers with me, 30-40% of healthcare is paid through governmental pay, 30-40% through commercial pay, and about 30% is paid for directly by patients now. It's that high number of consumers. The insurance side of it was intended to help Medicare manage costs better, Medicaid in some states manage costs better. That's become a disaster. That's become just an additional tax on the system. As far as I could tell, more than half of Medicare is now Medicare Advantage. It's going down a little bit, thank goodness, but it's and this is it's just been a disaster. It's just added another cost on top of costs. It's, as far as I can tell, it's just another tax, another administrative fee. The same thing with Medicaid managed care. The idea is that somehow or another these commercial payers could do it better. I don't really see it. It's just been a debacle. So yeah, so we see that the two big things we talk about constantly are supply and demand, and we talk about the power imbalance. Then we talk about healthcare having the hoping problem that prevention, GLP-1s, technology will solve it all. And we're a big believer as trust and verify that even though we like all those things and we hope they'll help, but we better have enough doctors and nurses just in case and to go with that. Um, but those are the things that we keep a really close eye on. Obviously, like oh my goodness, there's so many topics that are so toxic today, but we are saved in our nation by lots of immigrant doctors and nurses. But if you say that out loud in certain sectors, you get screamed down as you're a horrible person. But I mean, thank God for so many of the immigrant doctors and nurses that we have, or we'd really be in horrible shape. So there's that. There's so many of these things that are just have become political third rails, even though they're so important to how things work. You talk about hospitals and health systems. Like anybody who's attacking hospital and health systems says, well, the 340B thing's not fair. They're getting paid this or doing that. Or they say, oh, hospitals get paid more for the same surgery that this gets paid for. And what people don't recognize, and they choose not to recognize, it's almost learned helplessness, is that the quilt work of how hospitals get reimbursed is truly a quilt work. It's multiple different places. So you could attack, hey, this doesn't make sense to me in a vacuum. And you might be right, but it's really done to make the whole thing kind of work. Whereas about 60% of health systems have some margin, 40% have none, and it's not like I don't disagree on the site of service thing. I don't disagree on the 340B thing. There's a lot of these things, but you have to try and understand as a whole versus picking off the one issue that you like to understand how hospitals keep the doors open. And the hospitals and health systems are just that COVID proved it. It's proven over and over again. They're the critical safety net of our country. You have somebody, I have elderly parents. We got a young daughter. They're not that young anymore, but they all end up at some point in the emergency room. Not because we want them to, but just it ends up being the place that they have to go for whatever reason, and the system's just overwhelmed. Anyways, JJ, I don't mean to just
No,
talk
but
on and on.
it's all of the, those are all the factors that we have to deal with on a daily basis. And one of your points, 40% of our hospitals are with no margin. And for many years, we had no margin here at Hillsdale Hospital. And, my CFO used to come in every day, and you know what he said to me? JJ, no margin, no mission.
Right.
If you don't have a margin, we don't have a mission. And now you've got to find a margin. And it's hard to do that in rural communities where 70 or 80% of your payer mix is the government through Medicaid and Medicare. And then when that's cut, significant challenges, significant challenges. Scott, it is always a pleasure to have you on the podcast. As I said in the intro, it is one of our widely viewed podcasts when I have you on. And many people know what you stand for. You're right there in the middle, bringing both sides together, trying to have meaningful dialogue. I'm most excited about the opportunity to be with you here next week and then in February again. And I would encourage our listeners to please reach out to Becker's Healthcare. They're a great source of news information. I had a leader from Alabama today I was talking to on the phone, said, JJ, I listened to your podcast and I want to know, what are your sources of news? And I said, the very first one, Becker's Healthcare. You got to log in. So our listeners today that listen throughout this country, I'd encourage you. Scott Becker is a visionary leader. He'll tell you that he's just a simple guy doing simple work, but I'm going to tell you right now, he is a highly intelligent attorney, a great man, a mentor to many, and a visionary. And I really appreciate having him. Now, one of the things is when you get a mentor, a visionary, a great leader like Scott Becker on a podcast, you cannot leave the podcast without asking a very important question for listeners that are listening. And we do this with our closing segment, but it was really made for you. And we like to ask our guests, what piece of advice, what one tip maybe that you would give to a new leader entering healthcare today that would be a resource for them, something that they could just gravel, something around, wrap themselves around. What one tip would you give, recommendation, maybe that's what it is, and we're talking about rural, because you've had a lot of experience with rural, that a rural leader that you could give them today as a source of hope, inspiration, because Scott, there's not a lot of hope right now that we have. We're getting hit from payers. We've got, the from the 2 midnight rule to the Surprise Act, to the this, to the that, to the Medicaid cuts, to the Medicare cuts, all of those things happening. What one tip or advice would you give the new leader today who's trying to make it?
Yeah, no, it's a great question, and I always come back to the same thing in almost any type of effort, that it's really about building teams and building leadership teams and people teams, because at the end of the day, I think Jim Collins wrote the book Good to Great, and he said this better than I've heard anybody ever say it. The most important thing is getting the right people on the bus with you, and then you can figure out where the bus is going. So we've looked at it different ways over the years, and I just go through this from personal experience. Every business or effort I've been involved in where I've made the effort to build teams of great people, we've had great success. Every place where I've tried to do this without building teams, I've ended up not being able to have success. And so we view this as the critical thing is building core leadership teams. I remember 100 years ago, I served on the boards of 2 companies. One had one person who was an absolute superstar, but had not built a team around himself. The other one had several leaders that were all A-plus leaders. And the difference in the 2 companies' trajectories over 20 years was incredible, was very, very different. And it all comes back to it's like really what we talked about before. There's only so many things you could focus on. So focus on building great teams, taking care of your mission, which is taking care of your patients, and then figuring out how do you make revenues meet expenses. So you've got margin and mission. But it really comes back to you could do everything you need to do largely, and not always, if you could build good teams and a great group of people you work with, and then you could figure a lot of stuff out. If you're out there on an island trying to do it yourself, it just doesn't work. And I look at all these legendary entrepreneurs, and the great secret behind every one of them, whether it's Elon Musk, Bill Gates, Jeff Bezos, all these people, is Steve Jobs. They all built teams around them. Jensen Huang, all these people. You just can't do it. The person Judy Falk, who runs Epic, built this incredible team of people at Epic, incredible, and just kept on doubling and tripling down on it. But nobody does anything alone. Everything's done with great teams. So if I had one piece of advice to somebody, it's think about life in terms of building alliances and building teams. And then the next step is, okay, what are we trying to solve? What are our core things? And like anything in life, you can only do so many things. So really focus on what are the most important things we're doing.
Absolutely. Great advice. It's been a great pleasure to have you back on the podcast. I hope to have you back again very soon. And I look forward to seeing you in Chicago, where we can share maybe an opportunity to have a few discussions. But it is great to have you on the podcast and have your insight. Thanks for joining us today.
Sounds great.
And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural healthcare every Monday, wherever you get your podcast. Don't forget to check out the latest updates on resources from Rural Health Today at ruralhealthtoday.com, and make sure you subscribe to the show so you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.